My name's Russ Canfield. I'm a integrative doc. I tend to try to look a little deeper than most of my family medicine colleagues, and my practice, 360 medicine, I try to look at the combination of the body and the psyche and the environment with which we live and our culture at large. So I'm going to go through some slides. I didn't make a handout, but if anybody wants to get a copy of my PowerPoint, you can just give me your email and I can give it to you. The mission of my practice and my style of medicine is to establish an individualized wellness program through which the person comes into outer balance. That's my little Da Vinci body here in perfect outer balance, but as well inner peace and a Buddha, the peaceful mind that Elizabeth strongly recommends. So, you know, we're looking at two discrete but very important arenas. The outer healthy body, things like your blood sugar, your insulin level, your weight, your blood pressure, and you know, if you have a healthy body but you're miserable on the inside, well, that's not really going to get you very far. And the converse as well. If you're happy but your body is in disrepair, well, that's a partial level of health as well. The third or fourth leading cause of death in this country, pretty crazy. Just behind cancer and heart disease is the combination of drugs that we use to try to help us to be healthier are causing problems. And these are drugs that are properly prescribed and properly administered. The number of serious drug reactions hit a record high in 2008. And I'm going to make the case that we need a different style of health care. Less focused on pharmaceuticals. 40% of Americans would prefer alternative healing methods over conventional medical treatment. All too often the cure is worse than the disease. And this information comes from fairly conventional sources like the Journal of the American Medical Association and the Institute for Safe Medication Practices. This isn't you know, a marginal group making these statements. One of the first duties of the physician is to educate the masses not to take the medicine, quote by Osler, one of the founders of modern medicine, lived at the turn of the century. As far as drugs are concerned, the way they work biochemically, they tend to bind very tightly to their cell receptor sites, and they often irreversibly block specific metabolic processes. And they really should be used with caution. Herbs, vitamins, nutrients, they have the ability to modulate metabolic processes, and they can actually help the body to come into better balance. Very different chemistry associated with naturopathic solutions. And I'm going to make a case. There are a couple of significant reasons why we should be using more naturopathic approaches. One is that our food supply is just increasingly anemic, very nutritionally deficient, staggeringly so. We have a very commercialized food supply that is very pulpy without very much antioxidant value and mineral content. And secondly, our environment is toxic to an unprecedented degree, and we need higher levels of nutrients to be able to cleanse some of the things that we're exposed to at very high levels these days. So here's my little geodesic dome here of different biological capacities. So, you know, if we're to get away from the model where we're doing a lot of prescribing and what I might call pill for an ill medicine, we need to improve the way that the body functions rather than just controlling symptoms. For radically good health, I think it's important to be able to assess the working of the body from different perspectives. So we're talking about nutrients, replenishing key nutrients, balancing hormones, neurotransmitters, or just Elizabeth might make the case that, you know, we can allow them to be at lower levels in midlife. It doesn't necessarily mean we need to be like Suzanne Summers and drive all of our hormones back up to the ceiling? And is there successful aging versus anti-aging? But hormones and neurotransmitters as a big physiological piece. Oxygenation and energy production. I think we need a lot of antioxidants these days, more than a generation ago. Hydration, strengthening the immune system. I mean, it's winter, flu season. I think that there are significant things that we can do to improve our immune system and prevent autoimmunity or rheumatoid conditions. Inflammation. Inflammation is a pretty hot topic, buzzword. Inflammation leads to many chronic medical conditions. I'd say almost all chronic medical conditions are associated on a deeper level with underlying inflammation. Structure. In midlife, it's increasingly important to make sure that we're doing what we can to maintain strong bones, strong muscles, and so you can work at the level of structure with things like chiropractic manipulation, massage, nutrients that help to build bones. And then I'll talk about digestion, the gut, the importance of your core of being able to digest and assimilate nutrients, absolutely key for vital health. Medical diagnostic tests. To me, conventional medicine, the lab test that you get with your typical yearly physical exam, not really that exciting to me. It's more about basic screening and one-size-fits-all testing. And I'd argue that the typical cholesterol panel, that may be part of your yearly physical, I'm going to say that it's not a huge reflection on underlying heart disease risk. I wouldn't throw out the baby with the bathwater and say that it's meaningless, but I think that there are significantly more important tests that have a higher level of correlation with heart disease than the cholesterol panel. Other basic things like liver enzyme tests. I think if liver enzyme tests are fine, I think it doesn't necessarily mean that the liver's functioning optimally. Or pap smears, they're okay. Prostate tests or the PSA, I think that they're often falsely positive. And in general, these tests don't reflect your overall cancer risk. They can be modestly helpful. But so I practice what I might consider more functional or metabolic medicine. And the blood tests that I might use most often that I think really look a little bit more at your biochemical uniqueness, blood tests that I think any doctor could do and I think are very meaningful and pretty cheap, are things like a vitamin D level. Huge amount of research on vitamin D and its correlation with things like cancer risk and heart disease risk and diabetes risk, mental health. C-reactive protein, that's a very general inflammatory marker. It tells you if there's an underlying fire in the body that could lead to plaque formation in the coronary arteries, or a fire that could cause problems in the circulation of your brain and be a risk for stroke. Another one that I like is called homocysteine. That's a nice indicator of your level of sufficiency with B vitamins. And Elizabeth found that she mellowed her out in menopause, and I think that
very helpful.
and it's
Any stress.
yeah, it's superlative. And in my practice, I dispense a lot of vials of B vitamins and have my patients draw them up with insulin syringes and give them at home. Fibrinogen, another test that I order fairly frequently that looks at underlying clotting risk. So these are some basics that I might like a little better. Actually here, I'm looking at these different bases again more deeply than I think most doctors would. And I think most doctors are looking a little bit surfacey at symptoms. I'd say that's the convention. As opposed to, why are these symptoms coming up? What's the underlying metabolic disruption that we can work to correct to help you to be healthier? So in terms of lab testing, I'm slightly geeky. There are many different tests that I might do to hone in on very specific problems. So somebody's digestion isn't working very well. Very common for me to just do a poop test. Look at the balance of bacteria, and is there any yeast or parasites, or look at antibodies to gluten. If I'm concerned about underlying toxicity, I like to do something that some doctors might consider a little bit more avant-garde, and would be something like looking for heavy metals in the urine. Or I did an organic acid test on one of the people in this room recently to try to look at the underlying metabolic issues and to try to help to target perhaps some antioxidants that might be of help in supporting metabolism. So anyway, lab testing, I think when you're practicing metabolically, can get pretty sophisticated and lead to very targeted solutions. These are some hormones, and some of the most important hormones in the body aren't made in the ovaries or the testicles. So the pancreas, and Elizabeth is talking about blood sugar control and sugar, and even at a deeper level than blood sugar fluxes is insulin. And what are we requiring of our pancreas if we have a higher carbohydrate load? And insulin resistance that can develop in midlife. The brain, the central portion of the brain, and the hypothalamus and the pituitary releases all kinds of hormones that communicate with glands like the thyroid and the adrenals. Thyroid support is often a very key type of hormonal support that can be used in midlife and make a huge difference and increase metabolic rate and increase body temperature. The adrenals, the adrenals are glands that help us to respond to stress, and we need pretty high-level adrenal function living in our century here in 2010. So adrenal and thyroid also kind of work together, controlling metabolism.
How much of your practice is adrenal burnout? Or do you see that a lot? I know Robin does.
Huge. So somebody whose story is fatigue. I just don't have the energy and the endurance to be able to do what I used to be able to do. And you could look at it from different perspectives. You could look at it from a toxicity perspective, and what might be causing the adrenals to burn out. But adrenal fatigue, adrenal burnout is absolutely huge, and I think it's relates to a combination of our frenetic culture, and I'm guilty of that myself, of pushing my adrenals a bit too hard, combined with an unprecedented level of toxicity. Just fries the adrenal glands. Other hormones that you might think about more at midlife changing would be either the anabolic hormones like testosterone or the estrogens. And so these are some of the major sex hormones. And the decision to embark on any type of hormone replacement, I think, is very individual, and I don't think it's wrong to just allow hormone levels to fall. But there definitely are things that can be done to help to support or balance hormones. And some of the things that I think that are very, very basic that often get overlooked in my mind is that, like, if I give a guy some testosterone, it's important to recognize that testosterone very easily can get metabolically converted into estrogen. And estrogen is produced in both men and women postmenopausally in fat cells. So if I give a guy that's a bit heavy some testosterone, I need to do something to prevent it from becoming estrogen. Other things that I think are not talked about enough are estrogen metabolism and how the liver actually acts on estrogen and forms metabolites of estrogen that you end up urinating out. And some of the metabolites of estrogen are cancer protective, anti-inflammatory, and friendly. And there are other forms of estrogen, metabolites of estrogen, that are carcinogenic, inflammatory, make you more moody. And so for me, if I'm working in the arena of hormones, or if I'm working in terms of hormone replacement therapy, to me, some of the doctor type of monitoring is more than just looking at what is the estrogen level, and modulating sort of the dose of my hormones to try to get a certain urine level or blood level of estrogen. I try to work more on how to improve the metabolism of estrogen and help work with the estrogen in a way that it's less inflammatory. So that's a fairly sophisticated concept, but and I like topicals. If I use hormones, I tend to feel that topical hormones are a bit gentler than pill forms of hormones. I think that they're harder on the liver when you take them by mouth. And doses can really range significantly. You can be bold. You can do a bold Suzanne Summers kind of a thing and really jazz somebody up if you want. Stakes are a little higher when you do that. There's more potential risks. Or what I often do is just kind of targeted hormonal support and help somebody kind of get through. Okay, we were talking a little bit about neurotransmitters. I think neurotransmitters are equally as important as hormones, and it's fun to play with neurotransmitters. I like giving a little serotonin support and help somebody to feel a little bit more playful. Or somebody who's having panic attacks and very significant anxiety and palpitations and the whole bit. If you give the amino acid GABA, that'll chill them out. You don't have to use Valium. It's unusual that you have to use synthetic drugs. Or acetylcholine. Low levels of acetylcholine are often associated with low cognitive function, or Alzheimer's or dementias. If you look at it from a neurotransmitter perspective, often acetylcholine is low. Different ways you can support acetylcholine. I like what are called the phospholipids, like phosphatidylcholine as a supplement, or phosphatidylserine. In my practice, we might be so bold as actually to put them in a glass bottle and mainline it into your vein. Dopamine, that's the motivating neurotransmitter. And different amino acids can help to support dopamine function. Water, absolutely critical. We don't drink enough of it. We should follow Sophia Loren's lead and have 2 glasses of water before we eat our breakfast. And water, there's more to water than just the amount that we take in and it being hydrating. Water has a particular structure. The H2O molecules actually can form a superstructure, these buckyballs. And so I tend to like spring water, or I tend to like maybe aquifer water, like well water, and then maybe you put it through a charcoal filter to get some of the impurities out. I'm less of a fan of, say, reverse osmosis water than I used to be, because it tends to strip water of essential minerals and affects its superstructure. But here in northern New Mexico, we have a little bit of a emerging issue with radioactive material in the water, and uranium and plutonium and thallium, and really the only way to get some of those things out is through reverse osmosis. pH is, I think, something important to talk about the fluids that are in our bodies. So if you look at hydration, I'd say your weight in pounds. So if you're like 160 pounds, divide that by 2, you get 80. And my recommendation would be 80 ounces of water a day. If you live in the desert and it's the summer and you're active, multiply that by 1.5. So we're talking about fairly significant amounts of water. But also the fluids in the body, in addition to having a lot of body water, it's important that the fluids in our body be alkaline as opposed to acidic. And so I'll sometimes have patients check their urine pH first thing in the morning. And I like to see pH pretty close to 7, which is neutral. The lower, and you can use just little litmus paper strips and just urinate on a little strip and look at the color change to determine the pH. And the acidity in the urine is a reflection of a modest amount of acidity in the body and in the bloodstream. And metabolism just doesn't work as well in an acidic environment. Insulin doesn't work as well. These enzymes don't work as well in an acidic environment. Things that help you to maintain an alkaline pH would be things like just eating colorful food. That's a huge, huge thing. Mineral supports, just some calcium, magnesium, any kind of minerals that you'd take in. I'm going to talk a little bit about iodine. Iodide, I think that's a huge one. I'm not afraid of unrefined sea salt. And if you detoxify somebody, you get the heavy metals out of their body, pH will often change. Or you support the thyroid a bit, often the pH will change in a favorable way.
I have a question. Is the acid level of your body related to inflammation?
It can be. Yeah. I mean, I think that if there's an inflammatory condition in a person, and say maybe just do a basic blood test, and I see a high C-reactive protein. Yeah, pretty good chance that that person is acidic, but not always. Not always. Okay, the gut, the esophagus, the stomach, the intestinal tract. I think that that's a very overlooked area of prevention and wellness that a lot of my family doc colleagues aren't really working with. So I do a lot of stool testing, and some of the things that I do to help to work to improve gut health would be things like removing underlying infections. I find a lot of yeast overgrowth in the GI tract, or I think parasites are much more common than we know. And there are ways to work with just herbs that aren't particularly volatile, or I think you can safely work with some medicines to help to get rid of infections that might reside in the gut. I think it's important to strengthen the actual intestinal lining. I see a lot of what I call what's called leaky gut, where nutrients or food essentially gets absorbed through the GI tract before it's totally broken down and creates problems with the immune system. And so there's licorice root or aloe. It's something that really helps to strengthen the gut. A nice anti-aging, or I should say successful aging strategy, is supporting the digestive juices. Robin would very often give some stomach acid, some betaine hydrochloride, some hydrochloric acid to help to improve the ability of the stomach to break down protein or absorb B vitamins or zinc. You can also use digestive enzymes. That's a great or successful aging strategy to help to extract as many nutrients as you can from your food. Have those with a meal. And then re-inoculating the GI tract with the bugs that really should be there. So probiotics, Acidophilus bifidobacteria. Very, very basic thing that has a huge impact on health. Okay, so this is a fairly busy slide, but talking about diet, basically, and the difference between nourishing and toxic foods. Diet's a big issue. There's a lot of different diets out there, and this is really just kind of focusing on some of the basics. After seeing Food Inc., have you seen Food Inc.? Pretty scary. I've just really been thinking more about how some of the undesirable foods are loaded with toxins. First of all, they're refined. The genetically modified corn makes its way into so many processed foods, and so the carbohydrates in a typical American diet tend to be very refined, tend to be really based on genetically modified corn or hybridized wheat that has extraordinarily high amounts of inflammatory gluten in it. As opposed to, what are the nourishing types of carbs? Well, they're going to be colorful, It's going to be broccoli. It's going to be black beans. And I'm not too hot on grains, really. I like maybe a serving of grains. I think that we eat too much corn and wheat and heavy grains. I like people to juice, put vegetables in a juicer and have it be unpasteurized that you make at home. Fats, hydrogenated oils or rancid oils that are in the fryer that come out in French fries, or omega-6 as opposed to the anti-inflammatory omega-3s, or the kind of really beneficial fats you'd get in an avocado. Meats, there's the meats that are fed the genetically modified corn that are just very inflammatory. They're loaded with antibiotics, and they're not really meat. I think if you're going to have something that's organic in your diet, and you have to kind of prioritize, the thing that I would have be organic would be the meats that you eat, grass-fed.
And dairy.
Yeah, so your omega-3 eggs. So, if a cow is eating growing green grass, and then you're extracting the milk and making butter from that, totally different from butter that's, comes from a cow that eats the genetically modified corn and doesn't move. These are a couple of my favorite nutrients, and I think that it's extraordinarily common to see insufficiencies of both of these two nutrients. And I made the analogy of the iodine being the sort of essence of the ocean and vitamin D being the essence of the sun. So iodine, you can't make thyroid hormone without it, kind of important. It actually helps, that slide that I had that looked at the favorable and unfavorable estrogen metabolites. Iodine helps you to make those 2-hydroxyestrone metabolites, and it discourages the formation of the 16-alpha hydroxyestrogen metabolites. It's one of the most breast cancer protective things out there, and it's cheap. It kills bugs. You can put it actually topically on the skin and kills bacteria. And it actually facilitates detoxification. It actually helps to remove mercury from the body. Sometimes I'll actually do tests on people. We'll do iodine challenge tests, and I'll find actually higher levels of heavy metals that'll come out after they take a load of iodine. I think 6 or 12 milligrams of a combination of iodine and iodide would serve just about everybody well. And there's testing that I sometimes will do to kind of get a sense of when the body becomes sufficient. I think it's pretty hard to give somebody too much iodine. A very sort of basic test that can be done to look at iodine sufficiency is putting a sort of colored, what's called Lugol solution on the skin and seeing how long it takes for the color to go away. And if it takes less than 24 hours for a good maybe 2 by 2 inch square of iodine to become colorless, takes less than a day, then it's going into the body, you're not saturated, and you need more iodine. The Japanese or Okinawans that might have some of the highest levels of iodine and some of the lowest levels of breast cancer, they eat a lot of stuff that comes from the ocean. So seaweed, sea vegetables, that's a good source. Unfortunately, the oceans are kind of a disaster, and we have to be a little bit careful. Particularly, so any ocean-going fish or shellfish is going to be very high in iodine.
Mercury?
Unfortunately, the bigger fish, your tunas, your swordfish, your sea bass, they're going to be high in mercury and usually arsenic as well. I've actually done heavy metal tests on people. I had somebody who had a significant amount of, it was like an all-you-can-eat crab thing or something, and then we did a heavy metal test the day after and it had all this arsenic, and I couldn't figure out why, and then we figured out it was in the crab. Yeah. But iodine can detoxify, and it's good to be cautious and kind of ramp up on dose if you decide to mess around with iodine. It has a similar chemical structure to chlorine and bromine. So if you take a fair amount of iodine, you can actually get high levels of chlorine, and a lot of chlorine will come out into the urine. And if that's happening too quickly, you can get some headaches or irritability, or sometimes a rash. Sometimes you can actually kind of pull chlorine actually through the skin as opposed to breaking it down through the liver. Vitamin D, I'm on a crusade to give out a lot of vitamin D. I find it very supportive to the immune system. I find it helpful for my diabetics. I think that the literature on its ability to prevent cancer is staggering. I think we could prevent between a third and a half of all the breast cancer. There's actually one researcher at the University of California at San Diego who feels that his statistical model says that if we got everybody up to a blood level of 40 nanograms per mil on vitamin D, that we could prevent 75% of the cases of breast cancer. You know, so if you're looking at things like, should I spend some money on a mammogram or should I spend some money on vitamin D? I don't have anything against the mammograms. I think that, you know, they do save some lives, but vitamin D is definitely an important way to go. There are a couple of situations where I think you need to be cautious with vitamin D, and it tends to be people with underlying infections like Lyme disease, where if you bump up vitamin D3 levels, they'll feel worse. So, you know, somebody who's not vital, you know, I would ramp up on vitamin D and just make sure that they do okay rather than just kind of blasting them with it. And in some of those people, because the Lyme actually produces vitamin D4 and D3, I'll often use some vitamin D2 in that situation. But, you know, 9 times out of 10, I like D3. And I'm pretty bold. You know, you know, so the RDA of vitamin D is 400 IUs. I almost never give less than 1,000 IUs to my patients. So we can look at nutrients and kind of zoom in on even on a cellular level in terms of metabolism. And so the cell membrane, you know, the skin of the cell that is very involved in signals coming in and out of the cell, the overall cell function. You can improve the fluidity and function of cell membranes with fish oil. You know, fish oil has some what are called double bonds, and it's more fluid than Crisco. Or I like these phospholipids, or what's called phosphatidylcholine. You can improve on a cellular level the ability of the cells to produce energy with some bold antioxidants like coenzyme Q10 or alpha lipoic acid. I think this little guy here is a mitochondria producing the energy for whatever cell type this is. Or the nucleus, in order for cells to divide and for chromosomes to divide and for DNA to form messages. B vitamins are so critical. I'm a big fan of folate, or what's called methylfolate, or SAMe. There's a beginning understanding that our genes aren't really that important. And that, so, you know, your genes and your DNA reside in the nucleus. And I think that, you know, there's this conditioned sort of feeling that the genes are what make us who we are, because that's what contains the information or the blueprints, right? However, the cell membrane really is where the brain is in the cell. That's where all the razzmatazz is going on. That's where signals are coming in and then messages are being sent into the cells. So like Bruce Lipton, right, who writes the book, The Biology of Belief, and he's a cell biologist. He looks at the liquid crystal nature of the cell membrane and maintaining that fluidity and kind of dynamic ability to respond to the environment, for very precise signals to be hitting the cell membrane and messages being sent. That's what modulates which genes turn on and which genes turn off. And the genes in the nucleus itself, they just contain the messages, they just contain the blueprints. But the cell membrane is what controls which genes are active and which ones aren't. So you can change your genetic expression with broccoli, with nutrients. And I think that's a very important concept that none of my family docs seem to really get. They'll look at, it's not unimportant to do a family history and look at, how many diabetics are in the family, but it's really more about environment, and I think you can change how your genes are expressed by nutrition. So, physics. And Elizabeth was talking about music that has a difference in the frequencies that are coming in from each ear, and how that can entrain different patterns of brainwave activity. So in our practice, in addition to some bold nutrients, trying to replenish things, we also use things like light, like laser light perhaps, to improve the functioning of cartilage cells in the low back and help with back pain. That's kind of fun. Or we might use sound or vibration or some magnet therapy, or I use a fair amount of microcurrent, very small amounts of electrical current at very specific frequencies to resonate with the body and help to improve its functioning. So here we're looking smaller than a big antioxidant molecule. We're looking at particles and waves, and it's a little sort of more Star Trek-y. This crazy contraption here is called the life vessel, and here's somebody who's lying down on a mattress, and in this device you're actually exposed to some harmonics of actually light that comes through at the same time that they're getting exposure to sound, and there is a biurnal frequency difference right to left. There are actually some speakers underneath the chamber here, and then the whole thing's vibrating, and the vibration is actually picked up in the hands and the pressure points where the person's lying. So it's the combination of light and sound and vibration. So that's bumping it up to even another type of a level.
I just want to say, Russ let me try this thing out, and I didn't want to get out of it. It was very, very pleasing. But it's used for serious problems, right?
Yeah, it helps to balance in kind of a deeper way. We'll even just be aware that the room smells a little differently. These doors actually will close while the person's having their session, and sometimes I'll open the door and I'll have kind of an astringent I can smell that there's toxins blowing out of the skin or the breath of a person exposed to just harmonics of sound, light, and vibration. Underlying causes of illness or disease, we talked about beliefs and daring to evolve, daring to transform, letting go of conditioned belief systems. We're talking a bit about genetics, how these are supposed to be some chromosomes, and how it's difficult for us to change our chromosomes and our genes. However, nutrients and toxins can actually affect how our genes express themselves, and this is a very underlying issue in health. These here are dealing a little bit more ecologically. These little green bases here, underlying infections. This is a spiral-shaped bacteria. This is Lyme disease that, unfortunately, I'm finding a lot of when I'm looking for it. Toxins. We're living in an unprecedented amount of toxicity, and this is a molar that's full of mercury. Our families are our support. They also can limit us. Our family dramas can limit our personal growth. Within our consciousness our intentions and our beliefs actually can change our biology. And I think we have a choice of the types of things that we choose to surround ourselves with, or the kinds of beliefs and attitudes that we have. The Secret, talks about how you attract your beliefs, or Larry Dossey, who's here in Santa Fe, says things like, be careful of what you pray for. Or Greg Braden, he's actually here in Santa Fe, he talks a fair amount about the importance of belief and intention. This slide is going through some of the distinctions between balance, the scale, and horizontal balance, and replenishing nutrients, eliminating toxins, balancing hormones and neurotransmitters, making some healthy choices, versus, middle age is a opportune time for increased levels of self-awareness, personal growth, finding your true purpose, and vertical growth, transformation. You agree?
Mm-hmm. You get to know yourself finally. Well, I think when the hormones settle down or leave, it's a more peaceful time.
Okay, so this is just a little sculpture showing that our family is our foundation of support.
And the woman's, holding the whole thing up. I just want to point that out.
The woman's holding everybody up. So I think that it's important for docs to do a family history and look at patterns that come in families, but I think I would say that sometimes it's not just a straight up genetic predisposition for something, but there can be family behavioral patterns, like there are just families that smoke, or families that don't eat healthy, or I sometimes, in terms of family, and sometimes I'll talk about the Pima Indians and how they have an unprecedented amount of diabetes in the Pima Indian population, right? Like most of the adults in this Arizona Indian tribe are diabetic by mid-age. And so the discussion is, well, they're genetically predisposed to diabetes. However, 100 years ago, none of them were diabetic. And it has to do with the environment and them being acculturated and not eating traditional native foods, and shopping in supermarkets, and having refined carbohydrates. And so that's the kind of pattern that I think is sometimes more important.
And the commodity food that Indians get is almost totally starch. I think that's a big piece of it.
It's devastating. No culture has ever lived in the midst of so much environmental toxicity. The combination of chemicals, many of them are estrogenic in nature, heavy metals, plastics, just particulates in the air, mold, electromagnetic smog is, I think, potentially more important than heavy metals, actually. Radio frequencies and Wi-Fi and WiMAX, and it's very disruptive to the body. Okay, chelation, clearing toxic metals. Heavy metals are huge when it comes to the functioning of the human body. Heavy metals can block the function of enzymes in the body. They can block antioxidant pathways. So when you see a oxidative fire in the body and an inflammation, very often it's not just nutritional deficiencies, but it's underlying toxicity. It can affect the functioning of methylation and B vitamins. It can cause acidity as opposed to alkalinity. It can lead to overgrowth of yeast. But chelation doesn't always lead to feeling good immediately. And yesterday you were telling me about your experience when you had some amalgams, dental amalgams that had mercury in, so you went to the dentist.
I went to the dentist in Boston, and she took them out. And I didn't get them taken out for this reason particularly, but through the contraction and expansion over the years, it split one of my molars in 4 pieces. And so that kind of freaked me out. So, the filling did, and I had quite a few of them. So I went to my dentist and had them removed. And she was very particular and very professional, and she had all this stuff in my mouth so I couldn't swallow any of it, but I still didn't feel good for quite a while after I had those removed.
So it's important to detoxify slowly and try to prevent the release of metals into the body as you're taking them out of your head. I think yeast is a biggie. I think Lyme is a biggie that goes unrecognized, and I think it's a huge epidemic that we're not detecting. I think the whole environment in insects that are biting us is totally changing. You can detoxify through the skin, and this is just somebody in an infrared sauna sweating out toxins. Another way to detoxify, and this is actually a colonic, where somebody lies down and actually eliminates toxins through the GI tract. So sometimes I'll actually give some heavy metal chelator, and the next day I'll actually have them do a colonic and help to eliminate all the metals that have been bound by the chelating agent. So a couple ways to detoxify. Your environment is very important. There are things that you can do to keep your home from making you sick. Particulates in the air can be filtered out with a HEPA filter, circulate the air. There are a lot of flat roofs in New Mexico, and the intrusion of water from a roof that's leaking can create the growth of mold. And I think when you treat mold, it's pretty important to use non-toxic substances. I don't think it's good to use the phenols and the bleaches to get rid of mold. I like citrus oils. Electromagnetic smog. If you can look at your electrical wiring, sometimes I'll have my patients use a Gauss meter to try to get a sense of the electromagnetic signature in their house. I'm not a big fan of Wi-Fi. I'm not a big fan of cordless phones. As well as cell phones. I actually think that cordless phones have a higher disruptive electromagnetic signature than cell phones. And then let's go just a little bit further. Let's go. This was a fun one. So, is aesthetics important in midlife? And this is someone where I did some cosmetic treatment. I dissolved some fat in her jawline and put some collagen in her face, and she looks a little different. We can argue whether that's very shallow or if there's any purpose for aesthetics.
It makes you feel good.
So my model of medicine, what I'm trying to articulate is, really what we've been talking about here all day is that healing and vitality is a function of a person's aliveness, and I break it down into these quadrants. So there's the body, and this is the domain that most people would think of when they're thinking of medicine and healthcare. It's, the blood tests, the blood pressure. It's the objective, data-driven part of medicine. But there's also, on a kind of a larger level than your individual body, there's the environment with which we live, right? And we're talking about toxicity and heavy metals and all this stuff. So your environment or your habitat has an effect on health. And then on this side of my mandala are the interiors. And so, Elizabeth would look a fair amount at your interior attitudes and emotions, and is your life in line with your highest purpose? Are you making mindful versus mindless decisions? This is the domain of your internal experience that you can't see on a blood test. I can't determine, what somebody's thinking with a blood test. I really have to kind of relate to them. And then this aspect here is kind of the interior, larger than the individual person, and I'm calling it our culture, and how we relate, how do we understand each other. It's the domain of relationships at home, at work, at school, and our ethics, how we treat each other. Elizabeth talking about connection. We don't live as an island. We relate to each other. So this integral health assessment that I've been playing around with that asks some specific questions. It's divided into sections into this kind of 4-quadrant model and helps you to get a sense of how you're living your life and where productive changes can be made in your life. It's potentially a tool for self-awareness. It's not something where the goal is to get the highest score, but it's intended to be a vehicle to, maybe as Elizabeth says, to bust it up a little bit, do something new once a month, and try to achieve higher levels of health and wellness. And thank you.